I'm a lot shorter than Rachel. Can I?
Absolutely.
Okay. So I'm here to talk to you guys today a little bit about what we call medication-assisted treatment, which what I really want to talk about is Suboxone, which is one type of medication-assisted treatment. And this is something that usually brings up a lot of stuff for people. There's a lot of really strong opinions about it, and there's a lot of questions about it. And I will tell you guys that I've been sober a little more than 10 years, and I'm the kind of addict that had to jump head first. Like, there was no halfway for me. I had to actually stop smoking cigarettes and stop drinking coffee if I wanted to get sober. And that's just the way it was for me. And so I think for me, the first time I heard the idea of Suboxone, my first thought was, that's not being sober. Anybody ever had that thought? Yeah, like that's not sobriety, right? That's like cheating. And I think I'm fortunate enough that I also have had some really good teachers in my life, and one of the most important things I've ever learned, I think, in my recovery and in life is that the moment that I think I know the way things are, and the moment that I think I have it figured out, I'm screwed. And so just because something worked for me and worked well for me, it's not for me to judge that that's the way things should be for other people. So anybody here ever try and quit smoking? Anybody use the patch or nicotine gum or anything like that? Do you feel like you didn't quit? You feel like you didn't quit? Okay. When you were done, did you feel like you had quit? No? So you feel like you still smoke? Okay. So you can think of Suboxone in that way, right? That this is a stepping stone. It's not something that's replacing a drug or a drink. It's something that's used to help get off of a drug, right? And specifically opiates. We do this with things like nicotine, right? You've heard of the patch, you've heard of Chantix, you've heard of different medications, Zyban, that may help people stop smoking. We use a lot of medications here. Some of them aren't as charged to talk about as Suboxone, right? Lots of people are on different psychotropic medications, like for mood. And there was a time in 12-step recovery that when somebody was taking an antidepressant, they were considered not to be sober. Well, you're taking a mood or mind-altering substance. And I think despite the stigma about that initially, people eventually realized that that was something that could be very supportive of people getting where they needed to be. So if our goal is to get from like A to Z, right, and we know that we can get people to Z, is it really so important how we get from A to Z? Do we need to jump right from A to Z, or can we go like through the whole alphabet slowly? And that's one of the things we actually talk to you guys a lot when it comes to your treatment. Right? How many of you guys were told you need to go to halfway? You need to do IOP, right? If you go from all of this structure and all of this support and all of this supervision to like nothing straight away, you're setting yourself up for relapse, right? Does that make sense? And yet, when we think about that in terms of how we're treating our bodies, it seems like a completely different subject, right? And so for some people, it may be very beneficial to go like all to nothing. It may actually make a lot of sense to go from using what they were using to not using anything. But for other people, it may actually be supportive to slowly step down from like 100% to 50 to 25 to 0. And you know, one of the things about the human body is that it doesn't deal well with drastic change. Right? Everybody knows that because most of you guys have been through post-acute withdrawal symptoms, right? And so like when we suddenly stop something, just like what if the doctor would tell you, don't suddenly stop taking an antidepressant. Don't suddenly stop taking a medication that you've been on for a long time. Slowly wean yourself off. And with 12-step recovery, the basic idea has been that we should go from everything to nothing. And again, for a lot of people, that works really well. For me, it worked really well. But 12-step recovery also tells us that like we have no monopoly on how to get sober, right? And I think that sometimes that message gets lost. Sometimes the message of like AA is the only way or NA is the only way is something that feels like the truth, and the reality is that that may not be the truth for everyone. Is there anybody in here who has not had a friend or a person close to you die from a drug overdose? Okay. So that says a lot. And I'll tell you, I've been working at Transformations for almost 5 years, and there's a lot of things that we are doing right. And if we're truly going to look at how to help addiction, right? If we're truly going to look at how to keep people sober, does it really make sense for us to say, well, we're only going to look at it this way. We're only going to look at it the way that we've known how to do it. We're only going to look at it the way that I was taught to do it and that worked for me. No, because that's not actually what 12-step recovery teaches us, right? It teaches us to be open-minded and willing. And being open-minded means that we actually get to be open to things that maybe didn't work for us, that may work for other people. We get to be open-minded about the fact that if somebody has a high chance of dying, that maybe something that can keep them alive until they're ready to be on nothing is an option. And as much as it may be difficult in our recovery community here, in treatment, in some of the things we've dealt with, like in terms of our own personal experiences, I think that we're doing a disservice to people if we don't at least offer this as an option. The other thing I wanted to touch on is that one of the reasons that the stigma around Suboxone is so great is because there are a lot of people out there that are doing this the wrong way. Right? We've seen people come here that have been on this medication for 10 years, that have gotten an endless prescription written by a doctor, and the doctor has no idea what's going on with them. This medication is actually designed, like many of the medications that we use in treatment, to be part of a treatment program. So they call it medication-assisted treatment. This medication is designed to be used with recovery, with a sponsor, with treatment, with therapy, with groups, right? And so one of the reasons why we see like such disastrous effects from this medication is that there are people who are just using it as a substitute. That's not what it's intended for. It's intended to be something that slowly steps you down while you're taking part in dealing with the underlying issues, right? We all know that addiction isn't just about being physically addicted to something. It's about all the stuff that goes on for us that would have us say, like, I need to use this, drink this, take this to feel okay, right? And if for some people, they're not able to engage in treatment when they first get here, if post-acute withdrawals are so bad that they're not able to talk about their trauma, they're not able to talk about grief and loss, if it takes them 3 weeks in a 4-week treatment program just to be able to sit still and focus, then maybe there's something else we get to do for them. So I know that I may not change your mind about medication-assisted treatment and about Suboxone. I can tell you that for me, it took a really long time to even start to consider thinking about this as an option. But I think the more that I learned, the more I was able to see this as an option. The thing that probably changed my mind the most, we have very little information here in this country about this kind of medication. But in other countries and a lot of other places, they've used what's called harm reduction. So using medications and adding those to treatment programs to helping people get integrated back into society. And the success of those types of programs are tremendous. The amount of people who have stopped using drugs, the amount of people, and these are places where there are opioid crises like as bad as here. The amount of people who were eventually able to get off, the number of overdoses, how much that went down, it's pretty stunning data. And so like even for someone like me who like my initial thought was like, that's ridiculous, that's not sobriety, it's really hard for me to argue with facts and results. And so this isn't, my being here isn't a conversation to tell you how to do your recovery, but I would invite you guys to think about, if you see somebody who is using this type of treatment, to be compassionate with them, to be understanding, to get that they might want sobriety just as much as you do. And to understand that if somebody is going through this type of treatment and everyone around them is saying, you're not sober, that's not real recovery, that makes it pretty hard for them to be successful. So keep an open mind and ask questions and do your research and learn for yourself. That's it.